Hello, I'm Dennis Galecki. Welcome to the 608th Imagine Greater Buffalo program with over 220 YouTube programs on the Buffalo and Erie County Public Library YouTube channel. Today's program is the 8th on our new ImagineLifelongLearning.com YouTube channel. This program is created by the Center for the Study of Art, Architecture, History, and Nature, or C-SAAHN, as I like to pronounce the acronym, and ImagineLifelongLearning.com. Our lifelong learning speakers today are Dr. Gale Burstein, who is the Erie County Commissioner of Health, and Liz Urbanski-Farrell, who is involved as a consultant with Healthy Strategy. Liz also has worked in the past with Dr. Burstein, and we'll begin our presentation. So Liz, tell us about yourself. Tell us about what we're about to hear. Take it away.
Thanks so much for inviting me to be part of this presentation, and I am glad to be able to introduce Dr. Burstein with a brief comparison and discussion of health and wellness. I'm just going to pull up some slides that I have to share with you. Right, so I'm going to talk a little bit about wellness itself, wellness in Erie County, and a little bit about county, state, and national comparisons. I only have a couple of minutes, so I'll make this brief. So who am I? I am a healthcare leader and project manager with about 20 plus years of experience driving positive health impacts in private and public health and rural health across the state. And I have a couple of positions that I work on in addition to my consulting for nonprofits in the health and social sphere. So what is health and wellness? So we have some helpers. I want to give a brief definition of how those play into health and wellness because we have the health department here with us today represented by Dr. Burstein. So there's the healthcare industry, which treats people who are sick and works with medical care and can be reactive to a crisis or an injury. And they focus on individuals. And then there's public health with lots of preventive programs, social, environmental, and medical approaches to health and wellness. And they aim to keep people from getting sick or injured, often kind of behind the scenes. So the water you drink, the air you breathe, the restaurants you go to, and the food is safe to eat, and the food we buy is, it's all part of the public health infrastructure that we have in Erie County. It's more proactive, trying to be preventive, and it focuses on entire populations instead of individuals. So what is it going to look like to be well and healthy in Erie County? First, I want to define that. Then we'll talk a little bit briefly about measuring it and comparing it. So wellness, according to the World Health Organization Constitution, which is a great source, is a measurable status relating to physical, mental, or social infirmity or illness, but not merely the absence of disease. And wellness, on the other hand, which is what we're aiming for in Erie County here, is a state of complete physical, mental, and social well-being. So, of course, we're going to talk briefly about social determinants of health, what makes us well and healthy. It's our context, right? How much education, what education we have access to, healthcare, our built environment, economic stability, and our social and community context as well. We can think of it as the roots, for example, of a tree, that if the social determinants of health are not well nourished, and they're suffering things like, discrimination or segregation, poverty, poor quality schools, occupational hazards, those are going to result in worse outcomes for our health as individuals and as a population. Whereas if we have robust social networks and excellent access to healthy foods and healthcare and transportation resources, our tree of health will be strong and vibrant. So what do I imagine that would look like? Well, healthy workplaces, a limit on the pollution that we have in our environment, of course, robust cultural activities, health, access to health and wellness activities. Of course, our strong sports teams, our Sabres and our Bills teams is part of our health and wellness in Western New York. and lots of recreational activities. And these also need to be equitably available to everyone in order to provide health to the entire community. So where do we look to compare health in different areas? We can look at aggregate measures on a national basis. I rely frequently on looking at the Kaiser Family Foundation. The Robert Wood Johnson Foundation, also known as RWJF, is an excellent resource and well respected in its county health comparisons. New York State Prevention Agenda, New York State provides robust data sources to help to look at the health of the state and our counties, and the county health assessments, as the report that the county does periodically to report on the health of everyone in the county and our vital statistics, of course, birth and death records. We also have something called a behavioral risk factor surveillance system, or BRIFS. It's a little bit in the weeds there. And the CDC, the Centers for Disease Control, at a national level, where all of these things are contributing to the ways that we can look at health. And it's important to know that at this current time, they're also needing to be well funded in order to be effective and have reliable data and resources to support our health and well-being. So what does that mean? We found, for example, that profound inequities in the access to health and wellness can be documented across the states. And this is something from the Commonwealth Fund that really just, it's a little snippet showing the difference between the access to health and wellness in states. The white or the grayish dots at the top are white individuals who live in these states, and the darker greenish blue dots at the bottom are the statistics for people of color, people who are Black specifically, and who identify as Black within the states. So with this in mind, and this is fairly, 2021, fairly recent, the New York State Department of Health came up with its first prevention agenda, a focus to advancing health equity and reducing health disparities for everyone, not just based on skin color or racial ethnicity, but also on economic status and other social factors. So with that in mind, the Erie County Community Health Assessment and Community Health Improvement Plan was developed, and that can be accessed. I have a link if someone wants to take a quick snapshot of that to the internet link to that document and the Community Health Improvement Plan. And when you'll find a treasure trove of data about Erie County's health and wellness status. And then we can look at comparisons here, right? We can look at the prevention agenda tracking dashboard, and there's 84 indicators for the state. County data gives 55 tracking indicators, and you can look at comparisons. Again, I give a little link there at the bottom if you want to take a snapshot and take a look at that later on your own. See the comparisons of the counties. It will show you something like this. You can select a number of counties and compare different statistics within those counties and look at rates of difference. So there are all of our counties. And another resource for comparing counties is on the national level. I mentioned the Robert Wood Johnson Foundation County Health Rankings. And you'll see here that Erie County is squarely above average when compared to the United States and its health and wellness. So this is looking at an aggregate of community conditions and population health and well-being compared to the rest of the nation. We are definitely above the national average, and we're just a little bit below state average on one of the measures, and these are aggregate measures, so they're not perfect. But I just want to point out that Erie County is doing a great job of keeping us healthy and well with the resources that we have. And of course, with those social determinants of health, some of them are kind of, sticky problems to work on, right? That involve more than just a health department or one area of society. So what you're looking at here is a comparison of those different health statistics between comparable counties when comparing. It's important. I'm taking counties from New York State that have a large metropolitan area. So comparable to Erie, we have Buffalo. Monroe County has Rochester. Onondaga County has Syracuse. And of course, Albany has the city of Albany. So when you're comparing statistics, important to consider what you're comparing. We want apples to apples, not apples to oranges when we're looking at data. And we want to consider differences in geography and population and numbers without getting into too much of the weeds. That's what that looks like. Again, CDC, I mentioned, can be a resource, and this is just a snapshot of some older data from 2021 and 2020, taking some aggregate data and comparing it among the counties across the state. And you can also drill down on this Places app. I've got a little link there to specific census tracts and to zip codes to compare rates of things like depression prevalence or heart disease. And there are lots of different measures that you can look at on that website. Again, I want to talk briefly about numbers and accuracies. It's not something we all necessarily focus on. It's a little bit in the weeds, but there are a lot of specifics about the numbers we look at when we're doing comparisons that bear paying attention to. Things like the percentage or the rate, what is the measure that's being used, and how reliable is the information you're looking at. So larger sample sizes are better if you can get them. Smaller ones tend to be slightly less accurate. How old is the data? What was the method of calculation? What are the subjects? Are they the same demographically or geographically? We talked about that briefly. And is there bias in the authorship? So who's the source or who's paying for the research? Looking at who the authors are affiliated with, and they usually have to disclose any affiliation, but just using your common sense, right? If someone, where the data is coming from. And then statistical significance, this is definitely in the weeds here, but things like a confidence interval and a p-value or probability value of less than 0.05 or 5% or closer to 0.01 is best in looking at this data and how significant it is. And again, I'm not going to give a course on statistics today, but just so you know, there's a lot that goes into looking at those numbers and doing those comparisons on a national and state level. So with that, I'm going to wrap up my presentation. Thank you so much for the opportunity. And with that, I'm going to turn it over to Dr. Gale Burstein, our Erie County Commissioner of Health. Thank you.
So I'm Gale Burstein. I'm a pediatrician. I specialize in adolescent medicine, and I am your Erie County Health Commissioner. And today I'm going to talk about public health in Erie County because I hope that this is something that we cannot imagine a future without it. Hopefully we imagine our future with public health in mind in Erie County. So what we're going to talk about today is we're going to review the history of the Erie County Health Department and the goals of our health department. We're going to identify some current local public health priorities and some upcoming challenges and trends that we're faced with our public health system. So just as a backdrop, I think you all, are familiar with Erie County demographics, but just let me remind you that there are about 1 million residents living in Erie County. Buffalo is our urban core that houses about 275,000 people. We are part of the America's Rust Belt. About 10% of our residents are disabled under the age of 65. About 20% are older adults, and about 14% of our residents officially live in poverty. And so let's talk about why public health matters. So first, let's define public health and its scope, and then we'll talk about connections to our community for our everybody's well-being and safety. So we'll talk about what determines health outcomes. And I think Liz already talked about the social determinants of health, but it makes sense that if people are impoverished, they don't have food to eat, they don't have a roof over their heads or a bed to sleep in, they don't have access to health care, or if they do have health care, they don't have transportation to it, they don't have a job. It's really hard to think about maintaining wellness. So just some history of the Erie County Health Department. So we're a little over 100 years old. In 1919, the University of Buffalo established the Department of Hygiene and Public Health in response to the Spanish flu pandemic back in 1918. And then a lot happened in the 1940s after World War II. In 1947, there was an Erie County Board of Health met for the first time, and the first health commissioner started their job in 1948, on January 1st. Later on that year, the sanitary code was established. The following year, we started implementing public health programs, like a dental hygienist started applying fluoride to school children in 1949. Fast forward to the 1950s, Erie County participated in the Salk polio vaccine trials with 28,000 children who completed the 3 injection series in the trials. So fast forward to the 1970s, again, we had a flurry of new activity. The health department moved from City Hall to the Rath building. And then we had our first of consecutive large federal grants for lead poisoning detection and prevention. And then we opened up our public health clinic, our Jesse Nash Clinic at 608 William Street. And then, remember, if people are old enough or listening, remember the blizzard of '77, actually our Bureau of Emergency Medical Services responded to that blizzard to get people into care that were stranded back then in that blizzard, which they still continue to do today when we have blizzards. Fast forward to 1987, we opened up our first reproductive health clinic at Jesse Nash. And then in the 1990s, we started our tobacco control program. So we have, quite a history of interesting work. And then this is from a City of Buffalo annual report back from 1906. So you can see like what kind of public health issues we were working on. So on the top left is looking at the deaths from communicable diseases, and you can see that there's consumption pulmonary, that's TB. Look at, there are almost 500 people that died that year in Erie County of TB. There were measles, cholera, scarlet fever, diphtheria, whooping cough, typhoid fever. Again, most of these are vaccine preventable diseases or diseases that through good, sanitary practices, a good public health hygiene, we don't see anymore. So we're doing things very differently. Then below that are milk examinations. So the health department somehow used to inspect the milk. I'm not sure how they did that, but anyway, I think that may have been, before we had widespread pasteurization, but the milk was inspected. On the top right is looking at people that will, we have 2 columns. One is the scavengers, and the other is the placards. And so the scavengers, I believe that is, looking at, dead animals that the health department took away. And the placarders are, people who had different communicable diseases. Like here, we're looking at scarlet fever and diphtheria. The health department put a placard on the household that said, put people in isolation and quarantine because they had this, contagious communicable disease, to try to, break the chain of transmission and stop the spread by making people isolate and quarantine. And then on the bottom right is a description of our, at that time, our public health lab, but we've grown a lot since then. We don't just do micro, we do a lot of molecular diagnostic testing. We have a biosafety lab level 3. We do a lot of environmental testing too. So we've come a long way in that respect. So this is looking at the different, divisions and programs that we run in the health department. We're a pretty large health department. We have about 400 employees at the health department, and you can see up here a myriad of programs. So in our public health division, it's kind of our core, like bread and butter programs. We have, of course, epidemiology and disease control, where we do public health surveillance and where we look at reportable communicable diseases. We have our cancer services program. We still do some community wellness. We have our Office of Harm Reduction that's looking at our drug overdose epidemic, and then our Office of Health Equity that is, I'll talk a little bit more, but ensuring equitable healthcare access for all. Then we also have we still have the Jesse Nass Clinic that I talked about that was established in the 1970s, and in that clinic we have a sexual health clinic where we also offer PrEP and PEP. We have a family planning clinic, a TB control clinic. We still have TB, and we also have an immunization program. As I mentioned earlier, we have our public health lab, which is much more robust than a bacteriology lab. We have a medical examiner's office that investigates all suspicious causes of death in Erie County, and we're also a regional hub, so surrounding counties also refer cases to our medical examiner's office. We still have our Division of Emergency Medical Services, so in addition to responding to people in distress who are stranded and need health care during blizzards, we've opened up a new ambulance service. We have a paramedic and EMT training programs. And then, of course, we have our public health emergency preparedness. We have a division of special needs that does early intervention, assessments, and referral. We have a very large division of environmental health. That's actually our largest division, where we run both permitted programs where different agencies or businesses have to apply for permits, and to do that they have to pass inspections. So for different water systems, food facilities, if you go to any restaurant in Erie County, you'll see you should see a little sign with my signature on it that shows that they passed inspection, that we do pretty much annually. We inspect pools, camps, and tattoo parlors. We also run non-permitted programs to keep people safe. Like we have a rabies control program, we have a vector control program, so that's basically rats and some mosquitoes. We have our injury control and prevention, making sure that people have safe housing. We have a huge lead poisoning program. We have a big problem with lead poisoning among children in Erie County. And then we have our ATUPA, Adolescent Tobacco Use Prevention Act, where we have basically a sting operation where we send youth in to try to purchase tobacco products, and if they are able to purchase it, then we gotcha. So and some other tobacco prevention programs. So the question is, there's so many public health priorities. Like, how do we decide which one to take up? So we have a combination of different laws, and then also kind of looking at our data and observations to try to determine where we place our priorities and funding. So our Erie County Public Health Law encompasses the Erie County Sanitary Codes and the Erie County Division of Health Equity Act and the county's General Health Department regulations. So the Sanitary Code governs a wide range of public health and environmental issues, from food safety to housing conditions, and it's enforced by the Commissioner of Health, which is I for right now. And the Commissioner of Health is responsible for enforcing the sanitary codes, and the local laws establish the structure and powers of the various health-related departments and offices. So the Health Equity Act aims to address health disparities by creating an office dedicated to ensuring equitable public health programs and policies. And we decided the county executive decided to make this into a law so that, in future administrations, funding just can't make it disappear. So it's a law, and hopefully it will be here to stay and will stick. So Liz talked about our community health assessment and our community health improvement Act. And so our CHA, like basically we drill down, use publicly available data from health data that the New York State Health Department puts together. But in addition, what our Office of Health Equity does that actually writes the community health and plans the community health assessment is they go to different communities and they do surveys and focus groups really to identify needs of not just the general population, but specific populations in our community, because people different communities of our immigrants and our Black brown population have different needs compared to say our rural populations or our suburban more affluent populations. So we're really trying to understand what those differences are so we can address those gaps. Our CHIP, our Community Health Improvement Plan, is really our long-term effort it's our plan to address the gaps that we identified in our community health assessment. So together, the CHA and CHIP, they kind of summarize the information on our current health status in Erie County and the issue, and we also lay a plan out for the issues that we intend to address during the CHA and the CHIP. Whoops, sorry. Life of its own. Okay, so and as I mentioned before, it's really important to drill down into like specific neighborhoods and specific populations. And the pandemic, really made it very apparent how different communities had different types of access to different resources, and their outcomes during the pandemic, really differed because of their ability to access resources. So that could be due to health literacy, or even the ability to understand English and know where to look for that information. It could be access. It could be differ by transportation, the ability to go to places, say to get a COVID-19 test. So we're really trying to address those issues. So and that's what we're basically use those data to develop our community health improvement plan. So the initiatives, the priorities that we decided on for this next go around is mental health. We know that a lot of people are suffering from anxiety or stress, and again, that is not equal across the county. There can be different sources of stress in different populations, so we really have to think about how to address that, identify and address that. Unemployment. We're also looking at nutrition security, like food access, and then housing stability and affordability, because these social determinants of health are really, what predicts and drives well-being and good health in our community. So just some challenges and threats that we're seeing right now. So we're threatened by the federal budget, which affects the state budget, which affects the county's budget. We're threatened by federal policies, which affects potentially state policies and funding, which can affect local policies and funding. And then misinformation and disinformation is a huge public health threat. And some people are arguing that that's the biggest public health threat of all that we have now. But these are all connected, because many times this misinformation or disinformation is driving the policies that drive the budget. So we're all very concerned about the reduced federal spending on resources that are given to different public health programs, because usually what happens is that the federal government has money for different public health programs, important programs that we've taken for granted for years, and now those are at threat of being, they're being severely cut, or some of them are being eliminated. And so the state government relies on those funds to distribute to local governments, and so it's really going to be a trickle down effect that puts all of us at risk of our safety net that we rely on. And I think people don't even realize like how we all rely on some level of the safety net. So we're going to have reduction in like core public health services, like public health surveillance. So looking for communicable diseases. I mean, that affects everybody. We might have, our public health lab may not have funding to do the really cool, molecular testing that we're able to do. We were one of the first labs in the country to get, CDC's COVID-19 tests when it first came out, and way back with swine flu, we were also, because we're part of the Laboratory Response Network, one of the first labs to get those tests, but the CDC's lab's not really very operational anymore. So I'm not sure who's going to be develop those tests. Maybe the New York State Wadsworth Public Health Laboratories. Also we receive a lot of money from the state that gets money for the federal agencies for different public health clinical services and for, to help us enforce, food safety and housing safety and being able to do investigations for communicable diseases, and those are also at threat. I'm sure you've heard that EPA, CDC, EPA's, FDA's budget has been all severely cut, and again, some programs are being eliminated. So our funding for healthcare is being severely cut. It affects Medicaid, so that's all adults over the age of 65, and then some other people with disabilities Medicare affects all people over the age of 65, and then certain individuals with disabilities. Medicaid, provides health funding for people to access healthcare that are in the most vulnerable populations. Our SNAP program is, supplies supplements for food, Social Security. Those are more pressure on the states and private agencies to support those programs. And, there's just not enough to go around. I mean, that's just, a lot of pressure, financial pressure on everybody. So this really reduces access to health care and mental health care, and it really exacerbates our social and health inequities. So, some people, it's not going to affect them that much. They have, enough financial resources to be able to still access these services. But, many people in our community, as you saw, we have a very high poverty level in Erie County, are not going to be able to access those services. And it could be apocalyptic in 2027 when all the housing support and food support and healthcare support with, Medicaid and Medicare dries up, and where's the money going to come from to pay for all those services that we've always relied on. So, and then, these, healthcare, restaurants and laboratories and clinics, I mean, they're major employers in our area. And if they have to close, then that will also affect our workforce, and, more people will wither into poverty. Also, the federal government is cutting educational, funding for education. And so, we're not going to have like the same, robust academic institutions, and we're not going to be able to do the same type of research and develop vaccines or novel, treatments for diseases like we have in the past. So, that's also another threat that will affect everybody. So I'm sure you've seen on the news that our big public health and safety net systems are being dismantled. So, CDC is, basically not there. And I'm sure that, what was apparent to me with the recent news about the hantavirus and then also the new Ebola outbreak is that like CDC is not there. They're not mentioned in, at least the initial response for either the hantavirus or Ebola, and that's a huge loss. And then we also have policy threats with EPA, the FDA, CDC all being shuttered. We're not going to have the same type of regulations and protection of our air and water quality or our food safety. We're not going to have, the same type of regulation on authorization of medical devices. We know that the head of the FDA, recently resigned, after the FDA decided to approve, flavored vapes, which they're approved for adults, but, if they're out there on the market, kids are going to get a hold of that. We don't have the same type of support for vaccine and medication development. OSHA is disappearing, so there's not the same type of safety protections in the workplace. The federal government's policy on reproductive family planning and maternal care has changed. So, and right now there are these labor and delivery deserts. Even in Erie County, there in rural areas, the hospitals have to close up those services because they just, financially they can't make a go of it because they're not getting the same type of support. And family planning clinics are not going to receive the same type of support in the next year. And then we're just worried about our ethical standards with human safety and research. So, other threats are, loss of insurance. So, Medicaid expansion, the subsidies for Medicaid expansion are going to disappear next year. There's work requirements for Medicaid, and people have to recertify every 6 months. I mean, in the past, we were thankful that people could recertify just every year. So if people have to recertify every 6 months, I mean, that's going to force the counties to employ more people because we're going to have to do twice as many certifications. And insurance is so confusing. How would you like to have to deal with re-upping your insurance, twice yearly to make sure that you keep it? People are going to be losing their benefits for food and for some income supplements. They are people who are unhoused and also people of color that look foreign. They're being, and we're seeing some mass incarcerations. And then also with the federal grants for harm reduction, we're actually not, our ability to implement widespread harm reduction has been very limited, and there's just a very narrow lines of programs that we can support. Basically giving out Narcan, but the broader evidence-based harm reduction strategies are no longer supported by the federal government. So, this leads to some other threats like consolidation and closure of healthcare facilities. We know that private equity firms are buying up a lot of healthcare offices, and they're in it for the money, not the quality of care. As I mentioned earlier, we're seeing maternal health care deserts where hospitals are closing their labor and delivery wards. We're seeing an aging population. We don't have that is going to need, have higher demands for healthcare instead of reduced demands. And then there's rising costs for housing, education, and consumer goods, food. And, we're all feeling that. So these are other threats that, there's no easy answers. So, as I mentioned, misinformation and disinformation are huge public health threats. So, just to make sure we understand the difference between the two, misinformation is actually it's false information, and it's shared by people because they believe that it's true, and they just want to warn their friends or share this with their friends, but they're not intending to hurt anybody. They're trying to their motivation is benevolent to warn people, even though they don't realize that they're spreading, false claims, compared to disinformation, which is actually false information that is deliberately created and disseminated with malicious intent. I mean, it's really a form of propaganda. So, they each look like they can be credible because they usually use like one tiny component of it is something that could be true. So the whole message sounds like it could be true, and that's a strategy that is used. But however, it can be very dangerous. So we're even seeing it here in our community. So on the left-hand side was a post from, if you remember, at the Christmas 2022, we had, a huge blizzard, and, people lost in heat. About 50 people died of storm-related deaths, and there was some misinformation propagated that and if you call the county's, snow line, or they contact them for help, we're going to immediately be able to deploy the National Guard to rescue you, which is not true at all. We had no control over the National Guard, but so we tried the best we could to send out messaging to quash that piece of misinformation. Again, that wasn't promoted with malintent. It's just that people misunderstood like what the county's resources were, as opposed to the right-hand side. This is disinformation. This is actually this is a website from a local healthcare office that they promote themselves as offering pediatric care, even though there's no pediatrician that works there. And they have, very strong anti-vax messaging that they put out there to recruit patients. So, whoops, sorry. By itself. So what would our future look like without public health in Erie County and nationally? So we'd be back to 1919, where we would have to, list all the deaths from all the communicable diseases, because people aren't going to, we were not going to be able to enforce vaccination like we are now. And so we'll see a lot of vaccine preventable diseases and other diseases where we can't contain because, we won't have the enforcement power or the manpower for people to, isolate or quarantine if they have a communicable infectious disease that could, be transmitted to other people in the community and cause harm. We're going to have a surging chronic disease burden because we'll have fewer resources for prevention and treatment. We're seeing, we could see collapse of community prevention programs, both locally, federally, and we're also seeing this internationally already with the collapse of USAID, and CDC is not there of any of these international disease outbreaks threats. And then what will this cost our community? We're going to see people struggling with physical disabilities, financial struggles, severe mental health troubles. And this is going to be more pronounced in our vulnerable communities. And so that's going to even increase and escalate health disparities in our community and other communities. So what can we do? The forces against us are big. However, we do have some opportunities to fight back. So what we can all do is advocate to restore and increase funding at all levels, federal, state, and local levels. What we're doing at the county level is trying to leverage work with community partners and create coalitions throughout the state to have a louder voice and more manpower and more problem-solving abilities. What we're trying to do also is address misinformation and promote health literacy. But that's something that you could do too. Like if you hear a friend or a relative cite an incorrect health-related fact, you can correct them and help them to spread the message about what the truth is. So, we can all participate in this. We're trying to advocate to invest in innovation and promote the healthcare workforce. So, telehealth, helps people that are can't get to the whatever clinic for whatever reason. they're working, they can't get out of work, or they don't have a car or transportation. We can use AI for predictive data tools to see like who is most at risk of certain conditions. And then with mental health, I mean, we have new therapies right now. A lot of this can be addressed through telehealth. So again, try to use these new resources. We want to also try to enforce and strengthen policies that protect human and environmental health. Again, New York State has strong state laws, but we have to make sure that the federal government doesn't chip away at our federal protections. And then through all of this, we have to remember to place equity at the core of all the public health policies, because all of this is just growing our problem with health disparities in our community. So just want to thank everybody for listening, and just on these websites is information about Erie County Health Department in general, and then the second URL is for our community health assessment and community health improvement plan. So thank you.
Thank you both, Liz, for the intro, and Dr. Burstein for a comprehensive look at what the county does for well-being. I have one question. Last week we remembered again May 14th and the terrible events at TOPS that Saturday morning. People of goodwill all discovered zip code variations, equity, all sorts of terms like that were being used. Oshai Foundation, Community Foundation. My question is, does the county, your department, take a lead role in helping organize us as a county to try to do best practices, the smartest things to do to utilize our limited resources, but this collective energy that came out of that experience? How did the county and yourself connect with that ongoing 4-year process we've been living through?
Right, but again, it's thank you for that question. So the county wasn't leading this; we were participating in these efforts. And again, this is more of a grassroots effort led by the communities that were most effective, and we want to be as supportive as possible, just like we were trying to be supportive as possible and to help them deal with the aftermath. So again, I think we have to look at this as as a collective effort within our county, and whoever leads it, I think we all have to band together to be a louder voice and in a collaborative group to share resources and make ourselves stronger.
Well, I totally agree with that, and I'm sure if there's a way for the county to use all the information, the data, I hope this video is helpful to those that are interested in creating equity, in creating wellness, terms that are vague, but here you are identifying ways to measure these elements of lifelong learning, because that's what it's going to take. I assume, by the way, that somehow you connect with education so that we're not having to relearn the same things that one generation learns, that it can start with the institutionalized education that we have all these different school systems. Somehow I'm sure the county connects with them, but we'll save that for another day. Just at least assure me that somehow this information you've shared gets out there at that level and infuses school systems literally at all grade levels. Does that happen?
Well, we offer various resources to the education at all different levels, and we were happy to to share whatever information. It's really up to the schools to decide how they implement.
Yeah. Well, again, hopefully this video YouTube production will be utilized by people to really understand the great job that you're doing with changing times. Let's just be generous and call the times we're living right now as changing. dramatically so in many ways, especially as you pointed out. So again, thank you both, Liz, Dr. Burstein, for a comprehensive, good reflection on the history, since this is part of our USA 250 commemoration, to look back at different agencies at the county level and see how their history has got them to today as we celebrate this important time period in U.S. history. All right. Good job for
Thank you.
the county.
Yeah,
you
thanks
both.
for inviting us.
You're quite welcome, and thank you for doing this program. Thanks, folks, for watching this Imagine Greater Buffalo program on the new ImagineLifelongLearning.com channel. Remember, today's program can also be found as an audio podcast, along with over 1,500 ImagineLifelongLearning.com programs. Simply go to Internet Archive, search for C-SAAHN. It's the acronym is C-SAAHN, Center for the Study of Art, Architecture, History, and Nature. And you'll find over 1,500 recordings from Buffalo and Chautauqua since 2010 on the C-SAAHN network as part of the Buffalo-Chautauqua Idea and Connection. I'm Dennis Galecki. Be well and good day.